Hi, and welcome to another episode of TechCrunch Live. I'm your host, Jordan Crook. TechCrunch Live is all about helping founders build better venture-backed businesses. We do that by talking to founders and the investors who finance them to figure out how they came together, how they made decisions on the business, and what keeps them together and working together moving forward. TechCrunch Live also features the Tcl Pitch Off, which means that you in the audience can actually kind of virtually raise your hand and pitch your startup to our amazing guests. There's info on that in the chat, so go ahead, throw your hat in the ring. It's going to be a lot of fun. Before we dive in, I just wanted to share some info on some super cool stuff that we're doing at TechCrunch in the coming weeks. First off, Equity, which is our ultra popular podcast, is recording a live episode where you can come just like we're doing right now and actually chat with our hosts, Alex, Natasha, and Marianne. That's going down tomorrow. There's info on that in the chat and also on the reception page in Hopin. And we also have TechCrunch Early Stage coming up. It's on April 14th. It's our first fully in-person event since the pandemic began, so we're really excited about that. It's essentially the ultimate educational resource for an early stage founder. You can talk to experts in marketing, fundraising, and operations about any of your burning questions, and they're there to help. Okay, with that, I'm going to introduce our amazing guests today. We are thrilled to be joined by Kanye Macabella. He's the managing partner at Kindred Ventures, and the firm's portfolio includes Uber, Coinbase, Tonal, Tala, Postmates, and Color Health, among others. And in aggregate, the Kindred portfolio represents over $170 billion in value. Kanye, thank you so much for hanging out with us today.
Happy to be here. Hello.
We are also joined by Heartbeat Health founder and CEO, Jeff Wessler. I'm pretty sure he's a massive overachiever because he also happens to be a cardiologist. Heartbeat Health is a virtual cardiology company that incorporates telehealth, remote diagnostics, and digital heart health programs. The company has raised nearly 30 million, and Kanye is an early investor. Hey, Jeff, thanks for hanging out with us today.
Hey, Jordan, good to be here.
So let's just get into it. I think question one, and maybe Kanye, you should kick us off. How did you guys first meet?
Oh gosh, well, first meet, middle school soccer.
Whoa.
Yeah, I know.
That's not really easily replicable by the founders in the audience.
It's a little bit of a unicorn. But our first professional experience was biochem research in high school. Yeah, crazy. But for the purposes of this conversation, we actually reconnected when I was living in New York because my wife was at Columbia Medical School and Jeff was finishing his training at Columbia. And so we were living on the Upper West Side and we kept on bumping into each other. And then he mentioned that he had been thinking about doing something in business when he finished his training instead of going on to private practice or to academia or to one of the more traditional paths. And so that piqued my interest. And so we started jamming and one thing led to the next and here we are.
Yeah. So Jeff, why don't you give us like a 10,000 foot view of Heartbeat Health?
Yeah, sounds good. So I think the high level concept behind Heartbeat is we're a virtual first cardiology company. There's a new wave of these virtual first healthcare companies that are bringing a model of saying, we can do healthcare a little bit differently by bringing remote care, telemedicine, and then the virtual diagnostics and the virtual programs so that we can actually improve health and achieve outcomes on patients without laying hand on them, without bringing them into brick and mortar practices for all their care. So Heartbeat's developed this model specific to cardiovascular disease, which happens to be incredibly well suited for the virtual model because there are so many diagnostic tests, there are so many programs and disease states that can be managed remotely. And we've developed both a services model and a business model that helps bring that care out to scaled populations across the country.
So clarifying question, when you talk about remote diagnostics, why is it best suited? Like I'm trying to think of what I have in the house that could give you what you need to understand how my heart's doing.
Yeah, well, that's a good question. So it happens that the majority of cardiac diagnostics track with the physiologic parameters that the consumer device world has basically been developing around for a decade, and that the clinical diagnostic world has been developing around for 5 decades. These are things like heart rate and respiratory rate and oxygen saturation, activity level, and now the next stage above, things like your EKG or your electrocardiogram signal, echocardiogram or ultrasound of the heart, vascular testing about your veins and arteries, all the way up to your heart function exists in some form on devices as simple as the watch.
Yeah, wow. So before we jump, I want to jump into the deck, and I want to let our audience see kind of that early pitch deck that you used. But before we do, I was hoping, Kanye, can you talk to me about the story of that initial investment, just so everybody, because you're on the team slide in this deck. So you invested before this deck started circulating. So I just want to hear your kind of like origin story with Heartbeat.
Sure. So with Kindred Ventures, we're seed investors, and seed investors today are typically thought of as coming in when a company's baked, maybe a product is a little bit, in a prototype phase or just launched to a couple of people. But we like to invest sometimes earlier than that. And our view is when you meet a great founder who's got a great point of view about a market, just get in the water with them and start swimming. And so that's what we did with Jeff. One of the things that we always look for as investors and that we found in Jeff was somebody who has the combination of domain insight and domain experience. And so a lot of people who are very experienced in a domain actually are totally not insightful about it. They know all the reasons why you can never do something in that area.
Right.
But it kind of takes a beginner's mind and almost like being a little naive to have real insight in some areas. And Jeff just had, just happened to have that. And so when we sat down and spoke, what he was saying was, I think that there's a way to solve the cardiovascular disease entry point with a new model. Because what people don't realize about heart disease is it's the #1 killer in the United States by a significant margin. It's the most expensive to the health system in a major way, and it's preventable. And I was like, yeah, I didn't know any of those things. So you've already taught me something. So you're already insightful. And we've been talking about it for 2 minutes. And so it was one of those dialogues where every time he kept on sharing, statistics, not just about the like pathophysiology and the clinical parts of the issue, but the sort of context around it. It's the oldest field in medicine, the least growth mindset, least technology, most mechanical. There's so many inputs where I was like, oh, this sounds like a great area that if somebody can figure out how to tackle it, they can do something smart. And so what I liked about Jeff was that he was from that world, but he was not of that world. And so in that way, he could kind of separate himself and be like, the way that cardiology operates today is a little sleepy. The way that cardiologists think is not very growth mindsetting, and we can sort of bring a real intervention to bear. And ultimately, people at the seed stage are the most important thing. And I was really attracted to that. And the second most important criteria relating to that was, is this the type of person other people are going to want to partner with? Is this the type of person other people are going to want to work for? And so as part of our getting to know him, and frankly, part of our investment diligence process was we helped him recruit some technical co-founding partners. And the theory was if one of them was just like, holy shit, I'm going to quit my insert great job X to go work with this cardiologist, that's actually a really important input, that he has CEO material as well as clinician material. And he was able to do that. And basically, just as he was doing that, we said, all right, we're in, we'll be your first check. And so that intersection point was he clearly had insight, he clearly had expertise, and he was able to prove to us over that period of time that he could put together a team. And so we said, all right, let's get in as a result of that.
I love that. Like recruit, I mean, particularly in today's like talent market, if you can convince someone to quit their job and come be a part of this, that's got to be a huge signal. Okay, so why don't we jump into the deck, if we could bring it up. And Jeff, maybe you could kick us off in terms of like what you know to be the core of kind of how you pitch this company to investors. And I'm sure that spreads out to things like partners and customers and recruiters as well. But maybe you could point us in the direction through this deck of what you see being the stuff that really sings.
Yeah, absolutely. So it actually has been fascinating to pull up this deck again. This, I think, 4 4.5, 5 years old now, and to go through this, and in part because on the one hand, so much has changed. Our business model has completely flipped on its head. Our product offering is completely different, and yet somehow the DNA is still there. And this is the exact same pitch that we started with. And so I've enjoyed going through it again, and I'll try to walk us through the story here. If you want to just move to quickly to slide 3, even just to start, I think at a fundamental level, this is what has resonated with everyone from day one. Heart disease is the biggest health issue facing America. Humongous impact on disease burden. Every single person I've spoken with, since day one of Heartbeat, in a pitch capacity and a recruitment capacity from our team, has experienced heart disease with friends, families, loved ones in one way or another. And that continues to I think ring true, that this problem set is one really worth solving, worth being creative about, coming up with new interventions to improve the heart health of America. And so
Can I make a quick comment about that, Jeff?
Yeah, go ahead.
I just want to jump in quickly and say that there are some problems that as soon as you hear it, you're like, holy shit, somebody needs to solve that urgently. And not every great startup has that criteria. So send an SMS, sized message to the internet. The Twitter problem wasn't obviously a great problem that everybody really needed to see solved when it was started.
It is now, right?
But it is now. Well, there's a whole set of problems that we're solving now, right? But in this case, when you realize, oh, it's the number one killer more than all the cancers combined, and it is 80% preventable, almost everyone who hears that is like, wait, what the F, right? And so it was a problem that gripped you. And so I'm glad you jumped to this slide, Jeff, because it's totally what gripped me too. Anyway, please.
Well, and it does something else too, right? Like it's TAM. Like TAM is being introduced as part of the problem too. So from an investor standpoint, it's like, oh, 80% preventable and affects 1 in 4 people. Like, big problem. And also like really big problem. Like it touches everyone. We can all benefit, right? So it's it's 2 sides, right, of that coin that are effective.
Yeah, I think that's right, and I actually think, to the point about TAM, that's only become a greater part of the story, is showing, look, this is a great health problem, but it's also an incredibly valuable business problem to solve. And as we get further along year after year and get closer to actually seeing a model that can achieve cost savings among heart disease, then it just becomes exciting to everybody who's hearing this story. So I think we did early on a decent job, if you go to the next slide, with presenting, albeit now for me in a somewhat cringeworthy format. It's a problem that continues to resonate and hasn't changed at all. The traditional format of cardiology isn't working to move the needle on when we're caring for patients earlier in the cycle, with a care model that's more efficient, technical, and oriented at giving patients what they really need at the time. So we laid that out reasonably well. And I think as we get to some of the later slides and see where the business model that has ultimately changed a lot has evolved, these aspects haven't. It's still, this has stayed true. I think we've done a very good job leading becoming a national brand for cardiology. We're not direct to consumer anymore. We're B2B2C, but have paved the way for how you acquire patients, and really have begun to understand the right way to get in front of a patient at the right time, and create a tech-enabled product that can actually bring cardiovascular care right to your home and right to your phone, along with a network that can service the whole country. So it was fun to see, at least 3 of these don't exist now checkboxes have now been checked, and we're starting to pave that road moving forward.
So can we talk about because it sounds like it was a pretty fundamental one, the pivot, right? So you're like, we're going to be this brand, and we're going to get these doctors on platform that have equity in the business, and we're going to let people just come straight in the door. And now you're B2B2C. So can we talk about what happened? Like was it a slow grind where you're like, this isn't working, we got to go this other way? Talk to me about how that happened and the conversation that you two had working through it.
Yeah, so I'll start, and then Kanye, feel free to react to this. I think the initial acquisition strategy was focused on, can we build, if you go to slide 6, just while I'm chatting through this, can we build a model that can acquire patients directly? We subdivided the world into these types of patients, either those who have symptoms, those who have known risk, those who just had a life event and are starting to think about their health, the worried well who really want to try out new healthcare fads, and then healthy folks who are competitive and want to try new things. This model worked reasonably well. We built a decent following in New York where we started. We had people coming in, but what we quickly found is that we weren't touching the long-term opportunity here. And the first few slides you see, it was all about how do we actually change the outcomes? Let's change these sobering statistics on how significant of a burden heart disease is. Let's get to people earlier and make a difference. Instead, we were building a model of people who wanted to try the new fancy thing, but didn't really need us at that time and weren't really making significant changes in their long-term outcomes. So I think we had a pretty hard decision as a company to say, if this is going to not be a nice to have business, but a need to have for the whole country and ultimately the world, then we have to show that Heartbeat can influence these expensive, incredibly, dangerous outcomes of heart disease, and that we can reduce the number of heart issues and events that are happening. To do that, we had to get into the payer world. And, the payer 101 primer for healthcare is, it's incredibly hard to break into. In order to do it, you have to invest a lot in proving outcomes and demonstrating that your model, whatever it is going to lower the costs of a disease state and improve the outcomes so not sacrifice on quality or give better quality. And that takes years to show. So we ultimately sat down and said, this is the way we're going to, get to this long-term vision. We've got to invest years in it. It's not going to happen over 6 months. And we made the decision to lean hard into that. And I think, in hindsight, a few years later, that was for sure the right decision and has got us to a place where we're now seeing many thousands more patients a month than we would have if we were just building a D2C funnel.
What's your take, Kanye? Like when this kind of decision presented itself?
The way that I think about that take actually is a lesson I have in investing in digital health, but also investing in general, which is you hear these tropes of distribution is just marketing and customer acquisition, and you build your product and then you ship it and sell it, and those are sort of two different parts of the house. And what I've come to learn about digital health is that in digital health, distribution is product in many ways. And so figuring out who your channel partner is, why that channel partner is interested, how you're going to structure your product so as to fit that channel and to deliver it well is so important. And you can use heart disease actually as a very simple example because, and this is simplistic. And so Dr. Wessler, please, call me on my BS here, but if you exercise, if you eat well, if you stop smoking, if you sleep, if you take microstatins or relevant medicine, if you check your blood pressure early, then you're probably going to be better off. But how do you get those things to people when they need them? How do you get those things to people early enough? How do you get those things to people? And so actually distribution is the rub, right? Distribution isn't just like a tactic that you use to sell your product. Distribution is the product. And that was a big realization moment for me between, pre-seed and, somewhere around Series A, where it's like, holy shit, like we can't think of distribution as, we'll try D2C, then B2B2C, then whatever. It's like, distribution is literally our product. So let's build a suite of distribution pathways and like optimize these channels because that's actually, as core to our product offering as anything else.
Yeah. Wow. Okay. So let's keep marching through this. What else do we want to hit? There are a couple more slides on here, I think, that you guys highlighted as critical.
I want to jump to one, if you don't mind, Jeff. I want to jump to some of the slides where you talk about product. And so maybe we can jump to slide 7, just because, and slide 7 it's just a landing page, whatever. But there's something really important about this landing page for me, which is, oh, you're able to build a website. I can probably go to it. There's a real phone number in there. So you can, like, at the very basic level, build stuff. And one of the things at the seed stage that I'm trying to evaluate is, for every person who can create a deck, there's that divided by X who can create a deck and build the things in that deck, right?
Right.
And so you proved just with a handful of slides. This is an example of one. I think the slide after this, slide 8, might be an example of this, even though it's not beautifully sold per se. But I love the idea of, like, being able to build stuff. And so maybe you can talk, Jeff, a little bit about what you were building in that phase, because especially in healthcare, like, you're not building a smoking cessation tool, are you? Or what were you building? Because that jumped out to me and got me really excited, and that's part of what we pitched when we went out for seed.
Yeah, so I like this thread for a minute, that so we actually built a clinical practice. This was a hard decision to make. Should we build a practice, or should we work with existing practices? And building a actual clinic practice in New York, which has now sustained for a few years, it was probably the worst early and best long-term decision that we made, because early on it was resource consuming. It took all of our attention. There's a lot that goes into having the responsibility of seeing patients and giving them care that was separate from the responsibility of building a tech company. And yet, in the long run, what it served to do was give us a real testing ground, if you will, for patients and clinicians and everything that goes with that, to see what works with patients, what services can be delivered virtually, what needs to be in person, or I've started calling it terrestrial in terms of the care needed, and how do we go about testing our hypotheses in real time and getting to a better place. And a couple years later now, I think that practice gave us a huge leg up on saying, we're not building in a vacuum that we then have to sell our product to someone else, but we've already figured out what works. We've already achieved some degree of product market fit internally. And now when we bring it to a large enterprise customer, like a payer or a health plan, we have data to back up what works and what our successes have been. So, I think separate from can we get a website up and build, can we get these services out, actually following through and getting our first data set of patients and our first experiences with them was incredibly valuable. And I think something that Kanye frankly helped to push us to see through from the beginning.
Yeah, I love, Kanye, what you said about, like, a website. I don't think that investors often are as clear about that. It's like, oh, you have a real website at the pre-seed stage. Like, you've put some skin into the game, right? Like, beyond just like the mental exercise of sitting and thinking about it and maybe doing some market research, like, you've actually put a little skin in the game, bought a domain, and put, even if it's ugly, you did it, right? Not saying that Heartbeat Health was ugly, by the way, Jeff. This pitch deck, questionable, but I'm just joking, man. But I do want to talk about the idea of setting up like a brick and mortar anything, right? Because I think that, like, early stage founders, particularly ones with, like you said, domain insight, feel the need, right? And particularly in health and wellness. Like, now that I'm thinking about it, he was describing this, I thought of like 5 other startups that were like, and then we built, a practice, or then we built a pharmacy, and then we built, and I'm just curious for you as an investor who's invested in those kind of businesses, like, what is the threshold for you? Like, where do you think that starts being like wasteful and like a need for control that you don't necessarily really need or isn't useful, versus like what Jeff was saying, which is like, it was a huge resource drain, but ended up being really useful. Like, how do you measure that?
Oh, gosh. Well, you got to know what you're trying to prove. The best founders don't ever conduct an experiment without a very clear point of view for what they're trying to prove. and based on what that evidence is on that proof point, what they're going to do next. And so brick and mortar for psychiatric services, because insert hypothesis, right? And if that hypothesis is really interesting and they prove it, then yeah, go put some brick down, put some mortar down, let's go. Whereas we're building psychiatric services that could just as easily be conducted over video, but we just want to have a physical footprint. That doesn't track, right? And so the most important thing is you got to have a high quality hypothesis. And what I liked about his hypothesis originally, which actually has played out, was he said this is going to be our research lab effectively. And so we're going to have cardiologists in the Upper West Side, in mahogany paneled offices, like looking at AliveCore data and looking at Withings data and looking at echocardiograms that are coming through, some of which are in person, some of which are digital, and telling our product leaders and our engineers, like, this is what it means for our care, and we're going to have that long term. And so it's actually an R&D investment. That tracks, right? That's totally great. And 5 years in, they still do that, and it makes a ton of sense. And so not all brick and mortar is created equal in that way. If brick and mortar is your go-to-market and your distribution, your unit economics better be great, right?
Yeah.
Because to your point, that's real money, those are real bricks. And so the unit economic weakness is typically what I've found is the thing that people undervalue when they're thinking about brick and mortar for distribution. But if you're thinking about it for R&D, especially if that R&D is really important to your core hypothesis, I think it's great.
Yeah. That's a good point. I'm curious too, Jeff, about the partnerships, right? Because you didn't go and build hardware, like you didn't build a screening device, right? You said like people are wearing watches and they've got smart, scales at home and all kinds of shit. Like, let's just tap into those. But there was a point where you were like, that's what we're going to do, but we don't have any of those partnerships. So like, how do you go to someone like Kanye and be like, no, I promise I can get Withings eventually, right? Or like, how does that conversation play out?
Yeah. So we took a bet on the fact that those companies, as they evolved, would really need clinical partners like us to see their care through. And I think that comes from our team's understanding of how clinical care works, is that the diagnostics and the testing can't live in a vacuum without that downstream care. And that's what makes everybody excited, is if your watch is going to tell you have atrial fibrillation, then there needs to be a what's next. And so we're going to be ready to receive that what's next. So we certainly took a bet on that in the early days. And for 2 years, we didn't have a single, national partnership or anything that proved to bear. So we were just paying for let's use these devices to deliver this care. And then the tide started to turn, and it became clear that we were that national partner, and we were the ones that could work with these device companies that had amazing scale on the wrists of hundreds of thousands, if not millions, of folks around the U.S., but didn't have those. Really nobody was out there that could handle partnerships like that except for us. So now, as they came and said, "Look, we've got to provide a warm handoff for the clinical care for these patients," we were ready and waiting for it.
Yeah, very cool.
One thing,
we got about
let me say one thing, which is when Jeff was finishing his training, there was a moment because we had been talking for a while before the business got started, where we were talking to him about whether or not he should drop out of his cardiology fellowship and just be Dr. Jeff, not cardiologist, the CEO of this, versus Dr. Jeff, the cardiologist. And he said something interesting then, which was like, being a cardiologist is very different here, because the average age of the cardiologist in the market is like 55 plus, first of all. And second of all, being able to be the real cardiologist who says like atrial fibrillation, he said that, and like I got hives because I don't even know what that is. But he treats that. It sounds terrible, right? But he treats it every day. And so in terms of his being able to go to the CEO of like a digital watch company and say, "Hi, I'm a cardiologist with a venture-backed company. I'm gonna treat you," just hits different, right? And so figuring out where you have unfair advantages as a founder and have unfair advantages in your like team's surface area on the market makes a difference. And him being Dr. Jeff Wessler, cardiologist, actually made such a big difference and unfair advantage in that way.
Yeah. I was interested, like you wanted to be a cardiologist at some point though, right? You weren't like, I'm going to be an entrepreneur who's also a cardiologist, right? Because it's like a lot of money to spend on a degree that's just for like credibility, which is useful. I agree with Kanye 100% that you like, no, I know what I'm talking about. But like, how did that decision happen, right? Where you're like in school and you're like, screw this, like I'm going to go start a company.
Yeah, well, first, I like to think I still am a cardiologist, but I am
Yeah.
comfortable calling myself a virtual cardiologist at this point. And I think, yeah, you can call my parents and ask what they think of that decision. But ultimately,
Yeah.
my day-to-day working with this team on this problem scratches all the itches I've had about trying to affect healthcare and outcomes on patients at a high level. And that's why I wanted to be a cardiologist. So this hits that, and I think is doing it in a much more scaled, effective, and fun way.
Yeah. So, okay, we have like probably less than 5 minutes left before we get to the pitch off. So I want to know if there's anything else in this deck that we want to hammer home to the audience.
Business model.
Yeah, let's do it.
Two things about business model, and models are such an important. Yeah, great. So the reason why I look at a business model in general is I'm looking for heuristics that the things you're going to be able to do on the basis of your team and your product are close enough going to translate into large amounts of money. But that close enough, as you see, I literally just waved my hand. It's literally hand wavy at this stage often because you don't know. And you're going to have to figure it out. And the more innovative your product is, the more likely you're going to have to figure that out. And so what I looked at when I saw this was how many patients a month, how much money per patient, ballpark, how many people have heart disease? How hard is it going to be able to fund? Okay, wow, I'm suddenly getting to big numbers. Cool, right? Now, maybe you can talk, Jeff, about generally speaking where the business model is now and how many different metaverses it is away from this one. But it just speaks to the fact that like I saw big numbers and I could bottoms up calculate them in a credible way, and so that was enough. But we ended up somewhere totally different.
Yeah, we ended up in a complete different sphere than this, yet the assumption stayed true. The numbers of addressable patients are gigantic, much larger when it comes from enterprises like a payer, a health plan, or even a device diagnostic company. And where our story has ultimately landed is lower margin diagnostic testing transitioning into higher margin virtual care like televisits and downstream longitudinal care. Has proved to be a very sound model, and all I think was underpinned by this idea that we started by getting out there, doing those diagnostic testing, understanding our economics around them, seeing what outcomes they could achieve and how we could engage members and patients for the ongoing virtual care. So that stayed true, and I think honestly over time we've simplified the model a ton to make it very clear that bring people into a virtual first funnel, it saves the existing cost structure tremendously, and then improves the outcomes if you're doing it in the right way.
Yeah, it makes a lot of sense. And I'm curious too, from like on a more zoomed out scale when it comes to business models in a deck, right? Like this was easy to read and like you said, do the backwards math and get up to a big number. But like when you're putting a business model at a seed stage or a pre-seed stage, like, like, okay, here are my projections. Like, I don't know, maybe not. Is it smarter to like overshoot on that and be like, look how big it could be and like just really go for it? Or is it smarter to be really conservative with those? Or are you trying to get like, there is no truth, right? So you can't get close to the truth. So you're really like, when you say 20 patients a month, like, there's some research that goes into that, but it's also like, probably, like, how do you figure out where your baseline is when you're doing it that early on?
I don't. So there's a tension here. It's actually a nuanced question because one of the most common reasons why I pass on a team that is otherwise great with a product that's interesting is I don't believe the market they're serving is either big enough or growing fast enough. for them to be able to build a huge business in it. And so you do have a high burden of proof in being able to make the case that a market is big. Now, there are some markets that are big and are kind of tough. Like life insurance is a huge market. And, if there's a life insurance founder out there, I'd love to hear your pitch, because generally speaking, it's pretty crappy. And so, it's not just big, but it's big and high quality. And so you do need, as a founder, to make the case that if this thing gets big, it's going to be huge. Bruce Dunleavy from Benchmark has this quote, which is one of my favorite quotes about venture, which is that venture capitalists are not in the business of asking what could go wrong, because the answer is everything. They're in the business of asking what could go right. And how good that answer is actually really important. So you got to give me a TAM. That said, you also need to set goals that you can hit. And so if you say we're going to have 2,000 patients in our first month, and I say how, and you can't answer that, then you're living in la la land, right? And so that's the tension is you got to be able to create a step 1 that's reasonable, but a step 50 that's really, really, really exciting. And you got to keep those both in your head at the same time.
Yeah, that wedge to TAM is a delicate dance. Okay, indeed. With that, if you guys are cool, let's get to the pitch off. You down?
Yep.
Don't jump out of your seat now, Jeff. All right, it's time for the TCL Pitch Off. 3 founders have been selected from the audience to pitch their product in 2 minutes. Kanye, Jeff, and I will then give our feedback on the pitch itself, not the business, because we don't have time to get into all of that. Our first founder is Audi from iFocus Health. So if you're in the chat, go ahead and put your video and audio on in the Zoom. As they get set up, a friendly reminder about what's forthcoming at TechCrunch. Equity Live, first show is tomorrow, Thursday, February 10th at 10 a.m. Come hang out with the crew. And then early stage is going down on April 14th in San Francisco, and only 4 tickets at the $199 price point still remain. So please do not tarry on that. We're good to go. Did I say your name right?
Yeah.
Yeah. Oh, good for me. Okay. So what's going to happen is that green square in the Zoom is going to show you a timer. It's going to go 3, 2, 1, and then you'll have 2 minutes on the clock. Pitch your startup, and then we'll get into feedback. So good luck. Have fun. Go for it.
Thank you. Thank you very much. And thank you for this opportunity. I'm Adi Diner. I'm a CEO and co-founder of iFocus Health. We are addressing the problem of ADHD. And the issue, as many know, in many mental health conditions, and specifically ADHD, is that we have no objective measure. So there's no biomarkers that are existing for heart conditions or diabetes. So the way you choose which treatment works for your kid is by asking them or their teacher, how was your concentration today? Now, when my son was diagnosed with ADHD a few years ago, I decided that's not a good solution. And I also learned I'm not alone. 60% of the kids drop treatment altogether because they can't find the right treatment. So we found out you can actually solve this problem by a very easy way. Our eyes are the answer. So looking at our eyes, you can know how well a person is concentrating and functioning in the world. And you can do this on day-to-day tasks, not on a manufacturer test. So our goal is to use our tool to track improvement for people with ADHD and change the way we care for ADHD by bringing data in there. The product will be a clinical product working with clinicians because we want to make it easy and straightforward to collaborate between the parents and clinicians. We don't want to add more noise and more opinions. I'm saying I'm the founder. I have a PhD in physics. So this wasn't my space, but I decided it's too important. And my co-founder is an expert in data science and machine learning.
Good job. And with 15 seconds to spare, fantastic pitch. Good job. Kanye, you want to lead us in?
Yes. Thank you, Adi. That was really interesting. It sounds like you have some technology that's differentiated. And so, I'd love to hear a little bit more about how it works up front, because it sounds like that's part of the rub. And then B, to your point of I have a PhD in physics, I'd love to hear how you're able to build it. Did you license it? Did you borrow it? Did you build it yourself? And so maybe you can pull those things up front when you're telling the story. the objective measure for ADHD piece is great. You can probably do with a tiny bit less than that because it's intuitive. And then talking a little bit more about, the crazy eye tracking technology, and then maybe talking a little bit more about how doctors are going to start using that is where you're going to get my attention. You're going to have me leaning forward, but it sounds like a really interesting concept. And I guess the last thing I'll say is, you have a PhD in physics. You sound brilliant. There's no need to apologize for that. I have a PhD in physics, period. Right.
Yeah.
And rather than I have a PhD in physics, anything else, that's, just because, because it does speak, I think, to your technical sophistication writ large. And that's going to be something that I'm going to want to understand and underwrite to. So I think that's all good.
Yeah, Kanye, I have a PhD in physics essentially tells me I could solve any problem. So bring me one, and
Exactly.
There's no reason to caveat anything there. Adi, before Jeff hits you with some feedback, could you just take 30 seconds to explain what the product actually does? Is this an app on my phone that's going to use the camera to look at my eyes? What are you talking about here?
Thank you. And I should have been clear. We're not developing the eye tracking technology. The cool thing is it exists. And the worst mistake a founder can do is to try to reinvent the wheel. So you see many products using eye tracking today, and that's because the technology is becoming mature enough to be able to use it with the webcam. The concept, this would be a tool that runs on your child's computer. And we're choosing computer and not a phone because that's a study and work environment. And it will track, kind of like Grammarly tracks your spelling when you type, it will track your eye movement when you read, and will produce a report for the doctors.
Very cool. Love it. Okay. Jeff, hit us.
Great. Adi, nice to meet you. Great job. So, I think my focus and what I always like to think through is what's the experience changing effect of a company, a product, a technology. And I think you have that to tell. So I'd love to hear, I think you do a good job laying out what's the problem you're trying to solve. It's a hard problem. It's a really important one. There's a technology and a solution that you can presumably bring some data to show that it works. What does that look like? What does the world look like if you solve this problem? And what does the experience of your son look like if you solve that? I think that'd be really effective and personalize this. And just like, we've done with heart disease, I think bring this to a point where everyone can be compelled and understand what it looks like.
Thank you.
Can I say one more thing?
Yeah, go for it.
I just going to say one quick thing, which is another thing that is missing, and I know is in there, and you kind of glazed over it, but assuming there's off-the-shelf eye tracking technology, great. So what's the not off-the-shelf part? What's the super special thing that only you can do?
Right.
And is it the data science? Is it the analytics? Is it translating that into something the clinician can understand? Because I want to understand your core, why do you exist? And so the extent that you can really narrow that and have that shine in your pitch, I think the better.
Yeah.
Yeah, I think that.
Can I answer that quickly?
Yeah, go for it, Adi.
So there are two things. Our edge technologically wise, or our proprietary, is our approach and our data science. But what we're doing differently than everyone else is we realize that tracking progress for mental health is not the same as diagnostic. So you really want to see how a person functions in the real life and not go back to the same diagnostic test, because that's not how we progress. I'll have ADHD all my life. I just want to function better.
Fascinating.
Yeah. You brought up a good point, Kanye, which is I don't know if you guys, one of my favorite quotes, which is much less brainy than yours, is when the park ranger said that there is a significant overlap between the smartest bears and the dumbest humans, which makes building a trash can in a park very difficult. And I was just thinking about that because if part of the secret sauce is translation for clinicians and also parents, again, we're talking about a very different crossover. So making that something that's readable for both parties could be really interesting. Mm-hmm. Any closing thoughts for Audi, guys?
I heard an insight there, which is that mental health happens in your day-to-day life. And so you don't always want to measure it when you're doing your diagnostic tests. I would lean into that insight because when you said that, I was like, oh, that's thoughtful. So
thank you.
Thank you.
Okay. Really great pitch, Audi. Thank you so much for joining us on the Pitch Off. And we'll get on to the next one.
Thank you very much.
Okay, our next guest is Jonathan from Samaritan. You guys should be pleased. I think we have mostly health companies today, so right in the wheelhouse, doctor. Are you mad that I've been calling you Jeff and not doctor? Because I can call you doctor.
Yeah, I'm mad at Kindred saying that.
Oh, I'm gonna do it every time. Jonathan, what's up?
Hey, can you all hear me okay?
We can hear you, we can see you. Everything's working perfectly. This is a miracle. Okay. So you're from Samaritan, same drill. The countdown's gonna go 3, 2, 1, and you'll have 2 minutes to pitch your startup. Good luck, have fun. Go for it.
All right. Is my screen backwards or forwards right now?
It's forwards.
We can read it.
Okay.
Yeah.
Cool. Yeah, when you don't have a stable home, you're 30 times more likely to land in the ER or hospital. This simple fact drives $200 billion in annual preventable costs and reduces life expectancy by 20 plus years for populations facing homelessness, addiction, and mental illness. United Healthcare, Aetna, Anthem, and Common Spirit Health are all using my platform, Samaritan, to engage these last mile populations into the financial and social support necessary to address vital health needs like safe housing. Here's how our support platform works. First, we will team up with frontline care partners in a community to give out Samaritan memberships to target populations. Samaritan members get one of our Bluetooth smart wallets here from the care partner, sharing top level goals and breaking them down into composite needs and action steps. From there, members gain financial and social support to meet those strategic needs and also earn bonuses by taking positive action steps towards goals. Things like meeting with a housing navigator or accessing primary care or submitting a job application, attending a recovery group, things like that. Over time, more than half of our platform's members measurably improve access to care, income, housing, or another area of life, again, within 12 months. These outcomes are associated with 10 to 50% reductions in cost of care. And for this population, that can be more than $25,000 in customer savings per person per year. We now have annual contracts with 3 of the largest Medicaid plans and the largest nonprofit health system in the US, $800K in early ARR to support just about 1,000 lives. That's awesome. A drop in the bucket in terms of need. We've got a raise open. Would love to have you join us, Kanye.
You don't want me to invest?
I would love for you to invest, Jordan, and Jeff too. We have a couple CEO investors as well.
Full price of my Balenciaga hat.
Yeah, for sure. Let's talk.
Yeah, okay. So Jeff, do you want to kick us off on this one and share some of your feedback for Jonathan?
Yeah, Jonathan, I thought that was awesome. It hits home. What you're working on is, it's just a gigantic problem and huge need across the world. It affects every aspect of healthcare. That's the one area I would have loved to see more on is how does this affect the cost? The stats were a little hard for me to wrap my head around. The reduction in cost is really important, and so how exactly does stabilizing a home environment or creating a home environment with a social support system create that cost savings? And then how do you guys get a part of that? I think is going to be key to that business model. Everything else was spot on for me. It's a huge problem. The traction part of it, I loved hearing about. The fact that you guys have such traction immediately is proof point in itself to get everyone excited that this is not just an idea in a bubble. And if you can back that up with the how do you get from A to B, then I think it's a slam dunk.
Yeah, really appreciate the feedback there. Can definitely tighten that up.
I have the same feedback, but I structured it a little differently. And so the way that I was thinking about it was the pitch started bad and ended up terrific. And so you said $200 billion in a TAM, and I was like, that TAM sounds like it's so far away from the SAM, or the serviceable addressable market. Like, how are you actually going to turn that $200 billion of costs of unhoused people, showing up at the hospital on the system into revenue? I don't see any path to that, which is what Jeff said. But then by the end, when you said, oh, we have 800K on 1,000 lives, I was like, oh, you're clearly turning it into revenue. But how was like, you kind of skipped it. You were like, oh, there's a huge TAM. Oh, and we've got a bunch of revenue and high average revenue per user. Big social problem, big social problem, big social problem in the middle. And I think if you had gone from big social problem, obviously, big TAM, here's the SAM, here's the product, here's the cost savings, and had more sort of mechanically walked us down to here's $800 per individual that we're now already earning in changing these outcomes, then I would have been super persuaded, right? So just some food for thought there.
Yeah, that's helpful. Thank you.
Yeah.
Yeah, so I think one other thing, and this is like just a Jordan thing because I don't have as insightful thoughts as these two, is the prop at the beginning. I'm not sure how necessary that is, right? Like, I think, yeah, I mean, I get it, and it definitely like elicits something, right? And maybe like it works in certain scenarios, and if of all the pitch scenarios that it could work in, this is probably the one, right? Like, you have 2 minutes and make an impact. Yeah. But I just think that like, and it kind of echoes what both Jeff and Kanye were saying, which is like, I think the cost, both the medical cost and just the cost in general of having a homeless population is just like felt by all of us, particularly folks like Jeff in New York, Kanye in San Francisco, right? Like, when we're talking to coastal groups, which tend to be RBCs, we know, right? Like, it is a huge cost and it sucks, and we can kind of jump in, right? Like, I think more on the product, like more mechanical stuff on the product. And again, like the business model of how exactly money goes from this cost into your, the company's bank account is critical, that we kind of missed out on. And if you want to we have a minute left in your little session. If you want to talk to us a little bit more about that right now, I think it would be good use of time.
Yeah, right on. So yeah, our customers pay us either per engaged member per month. So for Aetna, it's actually $386 per engaged member per month. And we're targeting 250 folks with them over 4 months. So that's 1,000 member months at 386. So it's 386K actually for just San Diego and Sacramento phase ones. And so we get paid when we are able to successfully find a person off of a list of about 1,000 people that currently cost them 25 grand a year or higher. And so we will work with frontline care partners to enroll folks as Samaritan members, and again, just help them access money and social support that they need to meet critical needs and take positive action steps towards housing, which can cut their costs in half.
Yeah. Awesome. Well, thank you, Jonathan. I appreciate it. And it can't be said enough that like 2 minutes to pitch a health tech startup or any startup is a small amount of time, and it can be nerve-wracking in front of an audience. So you did a great job with what you were given. Yeah,
I appreciate it. Would love to continue the conversation, Kanye.
Email me.
Okay.
Email me.
What's your email?
Don't worry. I'm not offended.
It's exactly what you think it would be.
I'll go on that. Okay.
You can find it. I believe in you. Okay. Our final guest is Yu Chen from Curio Health. So if you want to turn on your camera and your mic, you can bang out this last pitch. I'm not great with vamping, so the sooner the better.
That's a pretty good vamp, actually.
Little pity laugh from Kanye. Here. Thank you. Okay, what's up, Yu Chen? How you doing?
Cool. I'm doing great. So it's great to be on the panel finally.
Cool. All right. So same thing. We're gonna count down to 2 minutes, and you take it away. Good luck. Have fun.
Cool. Thank you. Okay. Hello. My name is Yu Chen. I'm founder and CEO at Curio Health. So since the pandemic, all the virtual care programs has become really popular, right? Like remote patient monitoring programs, decentralized clinical trials. As a result, all the patients gonna get a device like this one, and smart medical device, so-called, right? But the result is they're now so smart. And the problem is nowadays, all the virtual care companies are really focused on building the features like taking care of patient, right? And integrates with EMR. And nobody is really taking care of these devices. And they're really lacking the device management issues. And as a result, all the burden to support a patient on the device issues are on the doctors and nurses. As you can see, it's inefficient and ineffective. And what we are building is a virtual care, for virtual care companies, we are building a plug and play device management platform, and to give them all the insight, they can see what's going on with their devices, all the issues, which patients start disengaging because of the device issues, so that they can involve early. And even better, we have the AI-powered virtual assistant built in, so that whenever we detect the issue, we jump out to help patient resolve the issue in real time, so that the patient, they don't have to struggle with anybody, they don't have to worry to call, right? To call their grandchildren or Google search. So we have a really great funding team, and with a deep industry experience in this area, cover from digital health to the clinical trials. And we started last year, and now we already have a customer sign up, and we'll launch in about 2 months. And we also have a full customer pipeline. And yeah, that's about us. And it's a huge market. Estimated TAM is $33 billion by 2026. And looking forward to talk to you guys.
Awesome. Good pitch.
Thank
All right,
you.
Kanye, it's to you.
I think that I understand it, but it's one of those things where it's a really good pitch, by the way, Chen.
Thank you.
I think that I understand it, but my immediate question was, is there something I'm missing? And so I am really excited to hear Jeff's feedback, because what I think of is, oh, cool, I go to the doctor, somebody gives me a medical device, and then I have to figure out how to get it working, or I have a medical device that's creating some sort of diagnostics, and then I have to somehow communicate that to my doctor around my care plan or around the management. And what I'm wondering is missing here is it really the doctor and the nurse who have to do that? And what I was trying to do was I was thinking back into my own experience, and so where I think you might actually benefit in your pitch is by giving a use case. So if you give a use case, I think that'll really bring it home. And I'll picture putting on the blood pressure cuff, and I'll picture emailing my doctor, and my doctor saying, "Oh, I don't quite know about the plug or about the Wi-Fi connection or whatever the heck." And then I'll be able to visualize exactly where your layer sits. Because as is, it feels intuitively pretty good, but I don't trust that I actually know if I'm not missing anything. So I would just add that use case to really make sure that it hits home for the audience.
Yeah, I think telling that story through, like, here's John, right? Or here's Kanye, and like, here's what they face. Like, that can be really useful. It can be overdone, but in this case, I think it would work really well. Jeff, I'm sorry, Doctor, what are your thoughts?
Yeah, thanks, Jordan. So it's certainly possible that I know enough about this field that this next point of feedback is not relevant, but it felt like it took a long time to explain the problem for me. And had you started with, look, patients get multiple devices, virtual care companies are dealing with thousands of patients with multiple devices, and that leads to a cost inefficiency that we're capitalizing on. That would have got there in 5 seconds, 10 seconds instead of a minute. And then a minute in, you started talking about the problem or the solution you've got, of which now I've got some legitimate questions. Is this a sale to a digital health company who's already managing the devices but is not doesn't own them? And if so, how does that work? Because the device companies have their own platform that they're recommending. So how do you get in the way of that relationship? Is the real problem you're trying to solve when a virtual company is using multiple platforms, you want to just aggregate those on one platform? That's an interesting point, but then how big of a problem really is that? So those are the specifics that I think someone with knowledge of the field is going to want to get right into.
Hey, Yu-Chen, why don't you take some time and answer those questions, since we have a couple minutes?
I'll start with Candy's question. I think that's a really good point. And actually, I experienced that personally in the previous company. We lost a customer because we didn't know things happen for the patient, right? And a lot of patient drop out, and then we eventually lost a big customer. And yes, a story would be much better. And for Jeff's question, we work with virtual care platform companies who, for example, providing the virtual care platforms for doctors, hospitals, and we integrate with their patient mobile apps so that we can collect all data. I think in many ways you can consider we're almost like a superpowered Google Analytics. And then we not only collect all the analytics and expose the insights and also engage the patient whenever we found there's an issue so that they don't have to worry about it for most of the time. And as for now, we only partner with manufacturers, companies. We don't directly work with them because they're a little bit too far from the end customer, which is the patient. So that's what we do.
Got it. Okay, Kanye and Jeff, do you have closing thoughts for Yu-Chen?
Yeah, I guess I have two quick ones. One of which, Yu-Chen, is when I think about building a central nervous system, even if it's just a support layer on top of 7 different technical stacks, hardware and software, that feels like a bear. And so I would address that bear either by talking about the strategy that you use, whether it's API endpoints that you're able to develop, or if there's a core stack that they all share to build interoperability, or I would talk about your teams. You talked about how your team has a lot of experience. Is it relevant experience? And should I just trust that you guys are going to be able to do it? And if so, then tell me a little bit more about you up front, and then I'll give you the benefit of the doubt that you can solve that. But you got to do one or the other of those, because as is, it sounds like a hard problem, but you haven't given me quite enough to know which path I'm going to use to decide that you can solve it.
Okay.
Yeah,
that's a really
and
good point.
Would help too if you took Jeff's kind of guidance there and shortened your problem. It gives you a lot of more time to talk through team and credibility.
That's
right?
That's right. Yeah, that's a really good point. Yeah, I had an exact very relevant experience before. I used to run iHealth labs and managing their enterprise team and including the device, all the device management. I have a lot of experience in this area. And our way to integrate with devices, we don't really go really deep. We actually is on the protocol layer. That's why it's really about, okay, this is a Wi-Fi device, this is a Bluetooth device. So that's why we don't have to deal with all the details behind the scene for each brand or each different type of devices.
That's awesome. A great core insight. I'd pull that forward in the pitch. So.
Thank you.
All right, thanks, Yu-Chen. Appreciate it.
Thank you.
Okay, so that's our show. We're 2 minutes late. So I'll just say a quick thanks to Jeff and to Kanye for joining us. You guys are awesome. Appreciate it. Thank you to all of our folks who participated in the pitch off, and to you, the audience. TechCrunch Live goes down every Wednesday at 3 p.m. Eastern, noon Pacific, and we will see you next week. Thanks.